All right, so I've reviewed my order and I've gathered my equipment. So I have my IV start kit, my flush, my needle, my J-loop, my gloves. All right, so I'm going to choose a 22 gauge catheter because this patient just needs some IV fluids and some antibiotics. I don't need to give them any blood or anything really quickly, so this should be okay. I'm going to identify my patient using 2 identifiers. So I'm going to ask them their name and date of birth. And then I'm going to explain the procedure. So I'm going to be starting an IV on you today. I've already checked this patient's chart and their health history as well, and I know that it is absolutely okay for me to use this left arm. And the patient has said that this is okay as well. So I'm going to be putting an IV catheter into your arm. I'm going to poke a little needle into your skin. Put this catheter in. That's all that'll be left in there. I'm going to take this needle back out, and then we'll get you some medicine through it. Sound okay to you? You're agreeable? All right. So I'm going to wash my hands. I'm going to apply my goggles as part of my universal precautions and my gloves. Go ahead and open up my stuff here. Now I'm going to apply my tourniquet. I'm going to check for the radial pulse. It's nice and strong, so I'm assessing that this patient has good vasculature here, and I'm also feeling to make sure that wherever I decide to start this IV, I'm not starting it in an artery. So I'm going to go right here. Let's go. Yeah, right there. And let's start down a little bit more distal. That way, if I blow this vein or miss, I have more opportunity to start them up higher. Actually, let's flip his arm over a little bit and we'll start it over here. How about that? So then maybe you guys can actually see this big vein that I'm going to stick here. Okay, so I've checked that. And then I'm going to remove my tourniquet. And I'm going to get everything else ready. So now I'm going to go ahead and prepare my J-loop. I'm just getting my flush ready. I'm going to connect this here. I'm going to make sure this is not clamped. Flush this till I get a couple little drippies. Take this end off and put it back in our sterile packaging. Sterile packaging. Keep it nice and clean. So now I'm going to reapply my tourniquet. And I've already ripped off a couple pieces of tape and placed them over here. But you can do this here, or you can do it while you're getting your stuff set up. I'm going to take all of this and set it off to the side. Now I'm going to clean. Some cleaning, scrubbing for 30 seconds. Let it air dry. And then I'm going to go ahead and insert my needle. So I give it a little twist. I'm not taking the catheter and running it up the needle or down the needle. I'm just twisting it to make sure that if there's any type of stick there, that it's not there when I am inserting it. So again, to remind you that there are 2 different ways that I can cannulate this. I can either do it using the one-hand method and use my finger. So I want to make sure these little notches are up on the top where my finger can get them. Or if I want to do the 2-hand method, I would flip them over to the side to where I can easily grab them with my left hand. So I'm going to use the one-hand method when I insert this. So I've cleaned my site here and I'm all ready to start. So I'm going to stabilize my hand on my patient. I'm going to go in at about a 15-degree angle till I get blood return. And then I'm going to gently insert my catheter. Now I'm going to remove my needle and apply pressure. Put my needle in the sharps, undo my tourniquet, grab my J-loop, making sure that I do not touch the end here, and I'm going to gently connect it. So then here we're going to go ahead and place our tegaderm to secure our IV. Just placing it over the hub of the needle, not over the J-loop. And I will peel all of this off. And then I'm going to flush it. From here, I'm going to go ahead and apply my tape. So I'm going to secure my J-loop up here, and I'm also going to secure it down here to get it nice and stuck. Then I'm going to clamp this off because I don't want anything going in or out of my patient. Then I'm going to unhook this, and ideally at this point we would have a Kuros cap that I could place on that to keep it from getting yucky. And then I'm going to time, date, and initial my little sticker here, and then what gauge needle I used, and then I will apply that to the dressing, making sure that wherever I put it, it's not occluding the IV site itself, so that way you can still assess through it. Then I would document that I started it in the left arm. So where I started it, I used a 22 gauge catheter, and then I flushed it with 10 cc's of normal saline, and the patient tolerated it well. He stated no pain. There's no redness or irritation to the site as of right now. So now I'm going to take it out. So I verify that my order says that I am to remove the IV. I identify my patient using 2 patient identifiers, name and date of birth, and then I'm going to gather my supplies. So my supplies for this would include a clean gauze, which I'm going to sit right here, and then also a piece of tape. So then I'm going to perform hand hygiene and reapply gloves at this point, and then I'm going to explain the procedure to the patient. So I have an order to take your IV out, so I'm going to peel all these stickers off, and we'll get this IV out for you, and hopefully everything will go pretty well. So then I have all my stuff ready. I'm going to gently remove the tape and the tegaderm. If you have an older patient and this tape is really stuck, or if you have a mannequin and this tape is really stuck, you can use a ChloraPrep or an alcohol pad to kind of loosen up that adhesive. So then it just peels off a lot more easily, so you can just kind of take and run it up under the tegaderm. And this just breaks down that adhesive so it's easier to remove. Being careful not to inadvertently remove the cannula before you're ready. So once I'm here, I'm going to hold my IV in place and gently pull the rest of this off. Now I'm going to take my gauze and gently place it over the insertion site, and then gently pull the catheter out. So I'm holding pressure for 30 seconds. I'm also looking at this catheter to make sure that all the parts of it are intact, because if you got this out of your patient and it looked like this and it didn't have this part, this would be a problem, because then that means that this catheter is now floating around in your patient. So holding pressure for 30 seconds, I'm going to apply my tape. And then I'm going to document. So I'm going to document the time and date that I removed the IV. I'm going to document what the site looked like. And then I'm also going to document that the catheter was intact.